sure that I don't forget to do that. Team Alabama is well represented, I see.
Yeah, I see that.
Great. Hi.
Oh, I have. Are they in here? No, they'll tear us a blue rag for my. Oh.
Somebody's not muted.
We're driving. Can you plug this into the?
So I have 12:30 on my clock. Let me know when you're ready and we'll go ahead and get started. This is addressed to Mary and Sherry and Carrie.
I'm good, go.
You don't want to rest in here. You're going to pull it out here.
Okay. Ready to go?
No, it's. Oh. Oh, okay. I'll do this.
Yes, Meg, we're ready to go.
Okay.
And I'm sure we'll have a couple others sign in, and that's fine.
That sounds great. So welcome all. We have a full agenda for you today, but before I turn the floor over to our colleagues with Population Health Improvement Partners who will be running today's meeting, let me take a quick roll call. When I call out your state, please have one representative respond on your team's behalf. And if you have graciously put yourself on mute, hit *6 to take yourself off of mute. I'm going to go ahead and start alphabetically. But before I do so, individual members of the state teams, please note your presence in the chat box by posting your name and your state affiliation. If you've already done so, you don't need to do so again. So let's start with Team Alabama.
This is Lolita McLean.
Hi, Lolita. I see your team is well represented.
Yes. Well, yeah, Lolita McLean, Vicky Mastin, Kimberly Lewis, Susan Colburn, Julie Prescott, and Sharon Henderson. And Melinda Davis will be in here in a minute.
Fantastic. Thank you. Colorado?
Hi, this is Angie Goodger from Colorado. I'm not sure who else may be on the call.
Welcome, Andrea. Indiana?
Put in here Jill McCormick from Washington State.
Hi, this is Shirley Payne from Indiana, and I believe Mary Ciccarelli is on the phone as well. Anyone else from Indiana?
Hi, Mary Ciccarelli here, and Gary Parker and Shirley Payne.
Hi, Justin Searcy.
Welcome. Kentucky?
Hi, this is Judy Terrio from Kentucky. We also have Ivy Alexander and Shelley May, and maybe someone else. They might be on separately.
Fantastic. Welcome. Judy, I can see your video. Massachusetts?
So, can you hear me?
I can.
Judy Fallfree, and I think Elaine is probably here.
I'm here.
Yeah.
Fantastic. Minnesota?
And I'll turn off my video.
Thank you.
Yeah, Minnesota's here. This is Sarah Cox, and I know at least Blair Olson and Rhonda are on, possibly Carolyn. Yeah. Thanks.
Fantastic. Welcome. Oregon?
Oregon is present.
Thank you. Texas?
Hi, this is Rachel June. I believe Ivy's also on the call.
Yes, I am. Hi there.
I see her in the chat box. Welcome.
Yeah, I didn't know Rachel was on the call, and I would have typed in her name too.
Thank you.
And Shane Fernando and Dr. Bowman, Paul Bowman, are also on the call.
Fantastic. Welcome. Washington State?
Hi, this is Paula Holmes, and also on the call with us is Jill McCormick, Sharon Fute, and Joan Zerzan.
Fantastic. Welcome. Last but not least, our from Wisconsin.
We have Tara, Sarah, and Holly here in Milwaukee.
Terrific. I see we have a total of 58 participants on today's webinar. That's a very good representation. We have folks from each of the state teams, and I know that several of our collaborative partners and our partners at HRSA are on the line today as well. So welcome to you all. I have a couple of quick, short administrative updates to share with you. Just a reminder that today is the deadline for registering for the April 17th and 18th in-person state team meeting in Chicago. You should have received an email from me on Monday with an attachment that provides both logistical details on the meeting and a reminder of the registration link. State team leads, please share this information with your travel team members if you haven't yet already. Approvals for travel being billed to Boston University are being made on a rolling basis and are being forwarded to your state team lead as they are approved. So keep an eye out for emails from me. If you have any questions or concerns about the meeting or need additional time to register, just let me know by email or by phone. So now I'm excited to turn the floor over to Mary, Sherry, and Carrie from Population Health Improvement Partners, who will be leading us through today's content. Take it away,
Thank you, thank you. This is Mary Webster, and I think many of you have seen me in email as I sent out the hellos for coaching, and we know that's coming up soon. And I guess my little reminder is if you have not had an opportunity to go to the SurveyMonkey that I sent out with that, so we can just get a good idea on the best time and days for our coach calls. That's a little sidebar there. Yes, if you yell out Sherry, Mary, or Carrie, one of us will answer. So yes, we plan to have our names rhyme like that. So welcome, and thank you for being here. Okay, we'll go to the next slide. So we have a few objectives today. We're going to provide a description of the QI methods this collaborative will use, discuss background and resources for initial state team decision making, discuss essential considerations for project selection, describe the components of a robust aim statement, and begin identification of your team's going focus areas. Now, you may look at this and think, how are we going to do this by 2 o'clock? Some of this will be high level, and just know that we're going to swing back around and talk about it at a later time, either through email or your coaching time or e-learning. So just bear that in mind. Okay. Next slide. So we wanted to kind of get to know you a little bit today. We're doing a little team forming here, and wondered if you would go ahead and answer these questions. So what is one thing you definitely want to succeed in during this CoIIN? So go ahead and pick an answer there. Just one person from your team, that's fine, but if everybody wants to pick, I guess that's okay too. So what's something that you want to succeed in? Making a positive difference, learning new QI-related skills. Everybody must check that. No, I'm just kidding. Achieve better outcomes than any other state. Learn more about best practices in care delivery, and any other ideas you can certainly put in the chat box. Okay, I see something in the chat box. Good. And I think you could just push the button there. Like just hover over it and click it. And then submit.
All right, just let me know when you're ready to close the poll.
Okay, we'll give that another minute. And let's go on to our next one. So that one's kind of a professional one, wanting to start thinking about that. Oh, look at this. Okay. Oh, well, you know, that's wonderful. I expected to see that, and that's why you're in this collaborative. Definitely, you know, you're people who want to make a difference. That's why you're in pediatrics and work with families, and so I'm not surprised to see that. And hopefully, all of those things will be taken care of. And we got a couple other people chiming in on the chat box, so thank you about that. And this is great for us as coaches to see too, you know, what your learning desires are. Okay, well, what about your favorite thing about springtime? Let's do a fun side. And some of you up north are going, spring, what's that? But what is your favorite thing about springtime? Go ahead and pick an answer there. Yeah, the snow is melting. Yes, the day the leaf buds come out, yes. That's some of mine, the flowers, a lot of flowers. And the weather getting better, that's for sure. Flowers and new life, yeah. Okay, let's see what we got. everybody wants the weather to get better, so that sounds great. And Meg, you only got a few people wanting baseball season, so and I know you picked that.
Well, they're not Red Sox fans, obviously.
But yes, the sun, the birds, plants, spring, all that wonderful stuff. So thank you for participating in that. That helps us to get to know each other a little bit better in a fun way. Okay, let's go to the next one. So I just wanted to do a quick review here, and most of you probably know this, but I thought we'd put this in just in case somebody's new. So what is a CoIIN? So it stands for Collaborative Improvement and Innovation Network. And it's a platform and methodology for participants to engage in collaborative learning together as virtual cyber teams. I know that sounds kind of scary, cyber teams, but yeah, we are virtual. And luckily, we do get a couple chances to actually meet together in person, which is a pure bonus and wonderful to actually have that one-on-one time with each other. But mostly we'll be doing this virtually around a common aim. That means we're going after this together. It may be a little different from state to state, but there's a common bond there in our aim. Applying quality improvement methods, and that's what we're here to help you with as well, to spread and scale policy and program innovation. And that probably is the big, I hope you don't hear my construction noise. That is really the part that I want to say that can be the toughest part is spreading and scaling that innovation. But that's why we have time with this CoIIN to learn and apply the improvement methods and test things. And that is how we'll learn what to spread and how to scale it. And the big key word too here is innovation. That was that extra I instead of just CoIIN. That innovation is really important. In which turn accelerates your improvement and strategies that contribute to our desired outcomes, which is within our name. So does anybody have anything else to add to that? You could tell me now, or you can put it in the chat box. That's fine as well. If you disagree with it, or if you've seen something better, you can let us know about that as well. Okay, let's go to the next one. So the CMC CoIIN, the HRSA Maternal and Child Health Bureau has funded this collaborative improvement and innovation network, the CoIIN, to test and spread promising care delivery strategies and payment models for children with medical complexity. That's the CMC. The threefold goals of this project are to, and this is interesting because this is what your biggest answer was here when we did that first poll, improve the quality of life for children with medical complexities. And you want to make their life better for these children and their families. Improve the well-being of their families and improve the cost effectiveness of their care. So these are our goals, but they don't necessarily tell us how to do it. That's where you come in. That's where your innovation comes in. Next slide. So technical assistance and coaching categories. The role of coach, which is us from Population Health Improvement Partners, is to provide TA, coaching, training, and connect you with resources in the following areas. And you'll see there's quality improvement, measurement. If we're going to improve, we need to measure, see, are we improving or not? Data analytic methods and interpretation of that data. How about data collection and reporting? And we have partnerships with the American Academy of Pediatrics and their KETA platform. Innovation, and that's, of course, with you. Collaboration, that's all of us together, state to state. Even collaboration within our own team and the people that we work with. Project management, because we want this project to start and finish on time. And then web platform, which is going to be a shared category. Okay. Any questions about that? So the triple aim, I don't know if y'all, the triple aim, I don't know if everybody's heard of this, and this came out of the Institute for Healthcare Improvement, and it came after the 100,000 lives campaign and the 1 million lives campaign. But I thought it fit in great with this collaborative. So you have these three dimensions here. And if you think about what we're trying to do with this CoIIN, it just fits in perfectly. And many improvement collaboratives around the nation are using this as their guide, even down to the site level, i.e. a hospital or a clinic or community health center. So we look at the experience of the care. So we are going to be looking at the experience of the families and how, even the experience of the care of those who provide it. The health of a population. So we know who our population is, and we express that in our aim statement. And then cost effectiveness. So if you're interested in looking at more from that, I highly suggest you go on the IHI website and you can join for free, and they've got a lot of resources for you. Okay? Now, when I talk about improvement methodologies and improvement science, I always bring this up because I think it's very necessary for system change. So I mentioned system. I'm not necessarily talking about a health system, but I'm talking about any kind of system that we have to change, even if it's your system around getting up in the morning and getting your kids ready for school and out the door. So to force that system change, the first thing is you have to have a will to do it. The will that it takes to change that new system. So think about if you're starting a new exercise routine or a new diet. If you don't really have the will to do it, it's not going to go off the ground. So part of what we'll talk about in future learning and when our coaching times is building that will. You most likely have it because you're here today, but you may be working with people who don't. They don't understand why we're doing this or where we need to go. So building that will is very important. And then ideas on which to base the design. So that's where our innovation work comes in, our brainstorming, our PDSA cycle. And a lot of times I think that's actually the people out there, and we tend to come up with a lot of ideas. And then execution of the changes to the system. That can be a tricky one too. So getting that execution, those ideas put to life. And that's, we get through that through testing as well and evaluating and then hardwiring things into the system. That follow through and sustainability. Next.
Mary, I'm sorry to interrupt. This is Meg. Can I just ask you all to double check and make sure that if you're not speaking, you're on mute? We're getting a little background noise. It sounds like someone's either building something or moving some furniture. Just got to go ahead and double check and make sure that you're on mute. If you don't have your own mute button, press *6 to mute yourself, and then you can press *6 to unmute yourself. Thanks very much. Sorry for the interruption.
No. So changing the system, what really happened? So this is, you might relate to this even if it's a personal situation. So say you are starting that new exercise program. The traditional model is that we have a problem. Okay, I'm out of shape. The solution is to start exercising a lot. And then I come up with a final plan, which is I'm going to start going to a gym. I go to the gym, and then there's system barriers. The gym is only open certain hours when I'm working. The gym's too far away. I never seem to have the right outfits on when I show up over there. I don't like any of the classes that they offer, so I don't want to go. So those are the barriers that occur, and then what happens with those barriers? I stopped going to the gym. I don't want to go. It was just a failure. So I started out with a problem, and I came up with what I thought was a good solution, and I just went ahead and did it, that Nike method. And I did it, and then I had these barriers that I didn't stop and address and look at and try to test new things, new change ideas that would help me stick with it if it was really something that I identified as a true solution to my problem. Okay, next. So when you use quality improvement to focus on change, we have the same situation. We have a problem. What is our problem even with this collaborative? And looking at the care complexity.
There we go.
The problem. And then we want to assess the current conditions in. Okay, somebody's talking, I guess. And then we define the possible solutions. So we will do a lot of questions. I'll ask you a lot of questions. We'll do a lot of brainstorming. We have quality improvement tools that we can use to identify and define those solutions, possible solutions. And that's where our PDSA cycles come in, those ideas that I was talking about. And that's when you do your evaluation of the data and your measurement to see, are those changes resulting in improvement? And that's how you can get your success. Next. So speaking of the model of improvement, this is one of the main methodologies that we use. And it shows you on the bottom how this is adapted from the original. And we do have a video that you'll be able to watch later. It's a 5 to 10 minute little overview of the model of improvement. And if you're not aware of it, I highly recommend this video. You could show it through a team meeting or, which would probably be the easiest and all. You could watch it at one time. But here you see it's broken down into these boxes. So we select a project, we assemble a team. So we're going to be talking, Terry's going to be talking about team assembling in a minute. And then from that, we start with the aim. What are we really trying to accomplish? Now, that may sound easy, but oftentimes that's where you really have to do a lot of discussions, because we in healthcare, again, we're smart, creative people. We're highly motivated, and we tend to come up with really big, wonderful ideas, but we may have to chunk it down into something that's reasonable that we can work on to get to that bigger idea. And we have to create some goals and measures. So how would we know that change is an improvement? Because not all change is an improvement. We all know change is around us all the time, but it's not necessarily always an improvement. if I dyed my hair flaming orange, it's a change, but it's not necessarily an improvement unless I do some measuring. So how can I measure that? Well, I could look at people staring at me, how many people stare at me with their mouth open, how many winces do I get, how many great job, it looks good. Okay, somebody says they're having a hard time hearing me. Okay. I hope this will get better. And then those ideas that we talked about, those what changes can we make that will result in improvement? That PDSA cycles, that plan, do, study, act, the cycles for learning and improvement. And we'll talk a lot about those over the next few months, and then even ongoing. We'll always be talking about PDSA cycles. What are some small things that we can test that will get us back to that aim? And that's where our spread and sustainability comes into effect, because we've measured it. We've actually looked at the data over time using run charts, and we can tell whether those things are improvements or not. And that's when we can say, okay, are we ready to spread that? And is it ready to be sustainable? And even in sustaining, you're still monitoring things, but you may not be monitoring the measures quite as often. You may go to monthly measurements or quarterly measurements. Okay, next. So then I also want to bring up this lean thinking. And here we go. Lean is a pervasive and empowered culture, and culture is huge with lean thinking. And I don't know how many of you may have experience with lean, may experience with lean in the past with your, where you work. We look forward to hearing about that in other calls. And again, it's based on the bias towards a systemic, endless elimination of waste. Waste is huge, and it's not necessarily waste like a lot of extra products, but think about what lean is. It's pulling out the things that aren't as valued to us, like time and extra documents and having to search endlessly to find things. Your supplies aren't ever in the same place all the time. Those kind of elimination waste, and that again is driven by what does the customer want. So going back to our innovation, that's a lot of what we'll think about is what does the customer, who is our customer, number one, internal and external, and what is their expectation for this care experience? We also have another video overview that you'll be able to watch on lean, and I highly encourage you to do that. So you may have heard of the Toyota way. That's where lean started. And it's fascinating work. I encourage you to look at it, and we'll talk more about it going forward. Does anybody have any questions so far? And again, this is a high-level overview, and later on we'll get into more of this as we keep going. Okay, next. So I am interested, though, in your groups considering what barriers to improvement are you experiencing or hearing about now. And you could throw some in the chat room if you want to, or just think about it amongst your teams, because it's good to go ahead and think about that in the upfront. And as Carrie will talk about in teams, one of the persons that's important in your team is what we call the power of the pen, someone who can come in and say, okay, I can help you eliminate that barrier, or I can see a way around that barrier for you. And yes, time is always a huge thing to hear. So we want to come up with plans as teams, and this is part of the things that we'll talk about with each other, is how do we approach those barriers that we know that's going to come to us? Oh, that's just another project. Oh, we did this last time, but it didn't work. I don't have time to do it. What are some solutions that we can come up with? So be looking out for that as well. Yes, timely and accurate information flow. And that is true. I mean, we're not dealing with a simple issue here. We're dealing with complex systems where families and children meet many different providers or have to go to another state even. So you are probably coming up with solutions, or what if if it was this way? Those are some of the ideas that we're going to want to throw on the table. It may not be something that's realistic we can work on at this point, but we definitely want the ideas coming for you, because that's how we can test things and hopefully get rid of some of these barriers. Yes, systems not listening and getting discouraged. I've definitely been in that situation and hear that as well. That's great. Yeah, we've always done it this way and it works. So just remember these barriers, not to just focus on the negative, but when I talk to my teams, when Carrie talks to her teams, those are some of the things we want to kind of work through in the beginning and have some solutions or some conversations to have back from that. And using the model for improvement and or lean, that framework can help you with that immensely. Next. Okay, so let's talk about some background and resources for your state team decision making. I know y'all are very interested in this. So, okay, let's go ahead and talk about what our definition is going to be for medical complexity. So we did have a consensus put together based on input from our national advisors, state teams, HRSA partners, and other experts. So this was consensus based. So the baseline definition for use by state teams, and if you haven't had a chance to write this down, I would probably do that. But of course, you'll be able to have access to these slides later. Children and youth between ages 1 to 21, so 1 to 21, with multiple significant chronic health problems that affect multiple organ systems, resulting in A, functional limitations, and B, high health care needs or utilization, and the last part, often the need for or use of medical technology. Now, I know we talked about this in our first kickoff webinar as well, but I wanted to go ahead and put this back in the slide set for you to look. It's very important. Now, if you see here, there is some leeway for your state. You're going to be deciding in your state is what does multiple significant chronic health problems mean? What does multiple organ systems mean? Okay, so Meg, do you want to answer that comment?
Sure.
About starting at age 1?
Sure. Thanks, Meredith. I think this is a really important question. So we decided to start at age 1 because we are looking at cost effectiveness. And there was a concern that babies in the NICU, their costs are substantial and significant and could skew our data if we included them in our sample. So we decided to start at age 1 for this definition of medical complexity.
Okay, so I hope that, thank you for that. Any other questions? Oh, any room for pushback on that?
Sure, sure. If a state is looking at a particular focus area and project topic where it would make sense for younger infants to be included in that definition and in their survey sample in their population, then we can certainly talk about that.
Okay, good. Great question.
And I know this is Carrie, and I know at the in-person meeting there is going to be some time during one of the sessions for teams to start thinking about how they're going to operationalize this definition, like you mentioned, Mary. So I think that could be a good place for some of these discussions to happen to get the sort of state-specific definitions nailed out a little bit as well.
Mm-hmm.
Yes, definitely. Okay, all right, so let's move on. So the focus area menu, this is really exciting too. This is our topic options. So 1 is care coordination, and that includes, and this again, I want to go back to some consensus work. Care coordination, including shared plans of care, and numerous states were interested in that. Transition from the pediatric to adult healthcare system, another one of interest for many. Access to home care services, and that's including discharge planning and home nursing. So probably access is probably the real topic there. Family and patient engagement, including shared decision making. And That's a big one. Innovative community partnerships. Care of rural children with medical complexity through technology-based tools, i.e. telemedicine, virtual care teams, etc. And then in bolded method, alternative payment methods will be incorporated into each focus area instead of just being a standalone. So that can take on different meanings, this alternative payment methods, but that's something that should be considered, and we certainly will talk more about this ongoing. Any questions here? We've got some great ones to choose from for sure. Okay, next. Well, how many should you pick? Well, let's look at this answer. All right, so each team will choose at least 4 over the course of the CoIIN. So that doesn't mean that all 4 need to be done this year. Thank goodness. So at least 4 of them, and they can be sequential, but you may want to start with 1. Why is that? Because these are big areas. These are big focus areas, and we want you to have good success on the early part. So, and this is part of your coaching time too, and work during the on-site. We'll be looking at that focus area. We're very interested in these 4, but what would be a great one for us to start with? Where have we made some inroads? Got a question there, Meg. Remember the work you may have already started. So on our call last time, we talked, many of you brought up, well, we've already started doing this, that. Well, maybe you want to build on that, and that's the way to get going. And then is there an area where there's some passion? And I believe you can all say yes to that. I heard that on the kickoff calls, that many of you are very passionate about working on, the transition care, that's just something that's been seen as a huge gap in your state. And that's one maybe your team wants to start on. Okay, so let's get going. Some value-driven decision-making. So going back to that triple aim, a big part of that too, and the reducing costs and the family experience, the patient experience of care and care delivery is looking at what is that value. And you'll hear that word a lot with lean and that methodology. Is it a value to the family? Is it a value to the patient? Is it a value to the team members, the healthcare providers? So what evidence is available to demonstrate that the decision you're making holds meaning for the CoIIN involved cohort for CMC and their family? So these are some questions just to consider at this point. And, going forward, the coaches will be bringing these questions back to you as well. And then during our time together in Chicago area, we will use these questions as well. How will you involve the CMC and their families in the design, implementing? That's very important. Evaluating those results, getting their input. That's a big part of that innovation. And then how would you consider the benefits, burdens, costs associated with it? And are those resulting from the decision equitably distributed among the stakeholders? So even with stakeholders, part of the work we'll be doing is identifying all those stakeholders, and we have tools to help you with that. And does the decision have implications for support for self-management and self-determination of youth over the life course? And does it have the potential to reduce inequities in some way? And then has the decision support transparency and accountability in relation to all your stakeholders? So again, these are big questions to consider, and you can't answer them all today, but these are some. This will help you in your decision making going forward as a team. Some may be easier to answer than others. And there's our reference on where this was adapted from. Okay, go forward. So I know we are getting a lot of questions, and I know that we'll try to get to all of your questions, if not during this call today, but we have a little time at the end. We will going forward, I promise. So tips for selecting a project. So you always want to look at your gap between what you would like your process to be and what's actually going on. So that means you may have to look at existing, what does mean? You have to look at existing data. That can be qualitative data and that can be quantitative data or a mix. Get some input from your staff. So have you been talking to the people working with these children? Have you been talking with the families support groups, providers? What's their pain point? And what are they saying? What are they identifying as gaps? And, you know, make sure you're definitely looking about what can be accomplished by the end date. And that's going to help us when we start working on our charters and aim statements to make sure that we start with something, but then we're not what we call scope creep, where we're, oh, that's good too. Oh, we need to do that too. And then we get off of that initial aim. So we'll help you with that as well. And these are some, you know, things I like to consider the following. And I know you will too, but the wow factor, you know, it's like, oh my gosh, if we get this done, this will just be icing on the cake. This is so, you know, everybody thinks this will be wonderful, and we know it would be. Value, okay, what's the value? Again, that might not be money. The value could be time or relationship. Low resistance from staff. So that goes back to getting that input from your staff and clients. You know, what's something that they're like, yeah, I agree with that. But you're building that will, so they're seeing what's in it for them and how that would help them as well. They're seeing the value. There's some support, a high level of support from your manager and leaders. They're also building into that will. And then also is their ability to track support or money. You know, that power of the pen. Are they able to say, yes, I'm going to let you have these staff members come to your team meetings once a week? You know, that's money too. Or maybe allow budget time for you to you know, redesign an office space. It makes it easier for these families to get in and out of the office. Next slide. All right, here's a project selection matrix that we're going to be providing for you. And we're not saying you absolutely have to use this, but it's a great way for your team to assign a value so you can get into these questions we just proposed to you, the selection criteria. So if you have your project ideas, examples 1 through 4, you can go through and rate based on those questions. So 1 being poor, 5 being excellent. So if your example 1 was setting up a clinic for children with special medical complexities, then you say, okay, so do we have evidence that it's meaningful to our patients and family? And everybody would talk about it on the team, like, well, you know, let's write down what you think, 1 through 5, and then you could come up with consensus of, let's say it's number 4. And you go down the list, and then at the end, you could actually add your own criteria if you have other questions that you think are important, or it's very sensitive to your health system. Does it meet missions and goals of the health system or something like that? We found this very helpful when you have a group of people that are working in different sites and they're a team. You can send it out to everybody. They could put their own scores, and then when you meet together virtually or together, you can tally up and get your average and then start your discussions there. Yes, I mean, you're right, Allison. There definitely could be some tension between focus areas and scope, and this can help whittle that down too, because when you're designing innovation, one thing to think about with the ideas is to, you can't become too emotionally charged by it when you're doing your group think and your innovation. And, you know, seeing that, wow, we're coming up with 5 on example. The most 5s came on example 2 and 3. And then let's go forward. Not saying that all 4 of these are important, but 2 and 3. Let's see what we could do with this one. It may help your decisions, knowing that you all collectively came to that discussion. All right, next. So we're going to talk about teams here in a minute, and I'll turn it over to Carrie. But what we talked about just in the last little bit was a lot of heavy stuff. And then Meg responded in the chat that she definitely sees all the questions that people have, and we definitely want to get to to your questions, and if we can answer some of them in this call, we will, and or afterwards. And yeah, you could add anything to that matrix. That's perfectly okay. That's what the joy of it is. We have space for you to add other things too. And you may just have to think about visual representation. Yeah, that would be really good. Thinking about that system again. So not necessarily, your system that you work within, but the system that everything that child connects with. I'm going to introduce with you at one point the care model, Robert Wagner's care model. It's a great visual of how this whole work fits within the multiple systems that interact with each other, with the main outcome and goal being that active care team, engaged family, and the outcomes that we want for their health. And stay tuned for that as well. Okay, great. I appreciate all the comments too, because like I said, this is heavy stuff, but we, don't fear. We're going to keep going back on that. Okay, they want to go back just one more time. Can you go back, Carrie, to the project menu slide? The menu slide, yeah.
And as we're going back, can I just ask everyone again, please double check your mute button. We're still getting a lot of that background noise. Thanks very much.
There's your focus menu.
While you guys take some screenshots here, and we will be sending these out as slides, I just want to reiterate what Meg's been talking about in the chat box and what Mary's been talking about. This is a lot of stuff, and I think the coach discussions and the in-person discussions will help provide some of that clarity around these focus areas. They are really big focus areas, so there will be smaller projects within each one, and I do think there will be a lot of overlap as well. And so I see a question in the chat box here, can the topics be worked on in parallel rather than in sequence? I think where that makes sense, that definitely can be done. We'll just want to make sure that you have the resources available to work on those in parallel. So these are just guidelines. They're not set in stone, so I encourage you guys, talk to your coaches, talk to the collaborative partners and figure out what works best for your team. So we will have some flexibility here. Keep the great discussions coming. All right. Mary, any last comments before we move to the team selection piece?
No, I think we got it. Again, you can still continue to put questions that come into your mind about the things we talked about, but again, knowing that we're going to reiterate a lot of the work that we did, especially around the methodology. I do encourage you to go back maybe during a team meeting and watch those e-learnings. Those are live links. And yeah, someone's asking for those links for the IHI and the e-links. IHI is IHI.org. www.ihi.org, and like I said, you can sign on for free, and there's tons of references, and I can help guide you with that as well, and things that you may be looking at.
Mm-hmm. And then for the model for improvement and lean links that were mentioned, we'll be sure to send those out as part of the follow-up as well.
Yeah,
and
look
you
at
guys
Meg's last comment too, very good. The collaborative partners and connections with that are AAP, the AMCHP, Health Management Association, Family Voices, and of course us. So we're one big family. We are one big connected family, and that's how we're going to get this great work done.
I agree. And as you guys have needs and questions and thoughts, let us know, and we'll do our best to use that information to drive the sessions at the in-person and future webinars and provide individual connections and all of that good stuff. We're going to move into talking about assembling a team. And as a part of this CoIIN, you guys have already identified a group of individuals that are a part of your larger CoIIN team. But once you choose your first specific focus area and your specific project, you're going to want to review that team composition just to make sure you have everyone you need at the table. And that's what we're going to spend a couple of minutes talking about here. So this quote says, "Teamwork is the fuel that allows common people to attain uncommon results." And I love to throw this picture up here because I think it's adorable. You see that little dog on the counter getting to eat a cupcake or whatever that is. I do think this picture does a great job emphasizing that our CoIIN work and really our improvement work in general is very much so a team sport. And I think that's very true with this particular CoIIN because we're trying to achieve things that really are extraordinary. And if we want to reach those goals, we've got to have the right people on board. And because of that, team selection really should be a conscious process, which you all already know because you've already put in a lot of upfront effort to make sure you have the partners that you need on that larger CoIIN team. And as you tweak your team composition to help you tackle that first focus area, making sure that you're intentionally selecting people that can help you achieve those project-specific goals and help you spread your improvements after you move to full-scale implementation will be really important. And then thinking not only about those individuals that comprise your team, but also about the dynamics that exist between the teams is also an important thing to do up front. And we know the goal here is to create a team of champions, which I know won't be difficult given the great group of dedicated people that we've already gotten involved in this point already. So here are some tips to keep in mind while you're reviewing your current team selection. First, once you identify that first project, think through who is on your team now and think through if anyone is missing. I also think after you select that first focus area to start with, it's a great time to reevaluate how you can involve your patients and your families. So think about your patient and family involvement in context of that specific project and make sure you're utilizing them to the fullest extent to get their really important feedback. And we're going to have a session on this at the in-person meeting as well. It's also important to make sure you have some team members who are knowledgeable of and involved in the process that you're wanting to create or improve. So I know one team mentioned that they were considering looking at a virtual care team for infant special care clinics. And making sure that we're involving frontline staff from that clinic is of course important. Also think it's really important to make sure we have cross-functional representation to help provide that holistic view of the process. So again, for that virtual care team, you might want that frontline staff in the clinic, but you also might want to consider including an IT person, a billing person, just to help us make sure we're not creating a process that operates in silos. And I think you guys have a really great head start on this, given that you were required to sort of have a cross-functional representation on your CoIIN team when you applied in the beginning. And then we do say that a maximum of 6 people for the core team is usually a good size because we want enough people to get those different perspectives, but we don't want so many people that you can't ever reach a consensus. And this doesn't mean that you may not need ad hoc members. You most definitely will. There may be people on your larger CoIIN team that don't need to be involved in detail within a particular focus area, but you may still need to pull them in periodically as an ad hoc member to get their feedback, especially around their area of expertise. So if your Medicaid expert isn't on your core team for a particular focus area, there most definitely will still be a time when you want to pull them in and get their input. And if you do decide to do different focus areas in parallel, you may have sort of 2 different core teams if your resources allow for that. So that's something to consider as well. And yes, I just saw in the comment, I'm Carrie. I'm sorry I didn't introduce myself before I started blabbing. So welcome. And then at the bottom of the slide here, you will see some specific team roles. And we encourage you guys as you review your team composition to make sure that you've got everyone at the table to think about who may fill each of these roles. So you'll see the team sponsor. This is sort of the power of the pen that Mary talked about. This person may not be a day-to-day member of your team, but it is important to keep them in the loop so they can help you remove those barriers as you encounter them and help you overcome some of those obstacles that you may not be able to overcome without some sort of authority figure. And then there is, of course, the team lead. This is the project manager. This is the person that keeps up with the day-to-day progress of the project. They know who's doing what to whom, and they delegate tasks to keep the team on track. And although they are sort of tasked with managing the timeline, I do want to reiterate that they can delegate so that they don't have to feel like everything's falling on them. And I think that's something that's really important. Then, of course, we have the process owner. This is the person who's going to be in charge of ensuring the changes are sustained once the project's complete or that new process is implemented. So we, of course, want to ensure we're involving this person from the beginning because that helps increase our chance of sustainability. You all have a family member or a youth with medical complexity on your team, and I believe you're all bringing that person to the on-site with you. We know these are the people that we're ultimately trying to please, and we're going to continue to talk about this throughout this project. We'll have separate sessions on it. It'll be interwoven to most of our other sessions as well, so we won't beat that down now, but you all know the importance of involving your patients and your families. And then our frontline staff, again, make sure you're involving the people who are doing or will be doing the work. They're going to have a lot of great information about where the current pain points in the process are, and they're going to have a lot of great ideas for improvement as well. And then you can see the last team role that we suggest you consider is a fresh perspective. This is someone that may be completely unfamiliar with the area that you're working on. Sometimes we get so familiar with an area of work that we lose sight of the big picture. So this fresh perspective can really help us take a step back and ask, why do we do it this way? Or have you thought about doing it this way? Just to sort of get us thinking outside of the box a little more. And then this just reiterates that for each of your focus area you choose, you'll have to think through who from your larger CoIIN team should be a part of your core team. So you'll see those potential roles that you have in your larger CoIIN team on the left here, and then you'll see some questions to consider on the right here. So again, who should be pulled into that core team? Who might be better as an ad hoc member? And is there anyone that's not involved currently that should be? So if you're working on a project that's centered around a primary care clinic, you may not need the hospital representative on the core team. They may be better as an ad hoc member depending on your project. You may also need to pull in a frontline staff member like the receptionist depending on your project, for example. And just as a quick side note, we know the in-person meeting is coming up quick. So if your core team that you end up developing doesn't match your travel team exactly, that's okay. There's some flexibility there. Also, what we learn at the in-person meeting is going to help us continue to think through who else we might need at the table and what changes to your team composition you need to make. So do know that this is flexible and don't feel like you have to work it all out right now. So any questions about the team composition piece? Again, I know this is something that you've already put a lot of thought into. We just wanted to take a second to reflect now that you have that list of focus areas. Is there anyone in particular, a position or a person that comes to mind as someone you may want to pull in for the project that you're considering that you haven't pulled in already? If there are any ideas, you can put them in the chat box. Yes, and we had a question here around what NOFO means, and Meg has answered notice of funding opportunity. So those were HRSA's instructions and requirements in the original proposal. So I believe each team was required to submit a team table, and I believe these were the roles that were required to be filled. So once you get those projects, those initial projects hammered out, talk to your coach, talk to the larger collaborative, and just think through if there's anyone else you'll need to pull in.
Carrie, this is Mary. One thing to consider on that last bullet item about who are you missing, about local experts and frontline staff, you may not know that yet because often you need to know exactly what process you're working on. And it could be down to, there may be 2 or 3 steps that involve someone who's not on your core, big team, on your larger team. So you may need to bring in, let's say, it's a pharmacist. And, you know, originally in your project, you didn't have to have a pharmacist, but for this one part of the process that's very important that's been identified over time, that's when you would need to bring that person in. So you may not consider these people right now and have any idea who they may be, but just keep that in mind that I like to say whoever's touching the process is involved in improving the process. So just keep that in the back of your mind too as we go forward.
Yes. Wonderful. Okay. So now we're going to move to talking about developing an aim statement. And here is our friendly model for improvement again. Like Mary mentioned earlier on, it is a roadmap that helps guide us as we move through the different stages of a project. So you can see once we've selected our project, we've assembled our team, then we move on to developing an aim to help us define what exactly it is we're trying to accomplish. And you can develop an aim at 2 different levels. So we are going to ask you all to develop an aim at the overarching collaborative level for your team, and we've provided a sort of a starter aim to help you do that, what we'll see in a second. So you guys have developed your CoIIN team. We have our overarching CoIIN goals, and we'll help you guys develop an aim at that level. And then we're also going to talk a little bit about developing an aim at that focus area specific level. And you guys will get to see this model for improvement over and over again as we introduce new tools. And like Mary mentioned, we will be sprinkling some lean tools in as we move along as well. What is an aim statement? Aim statement, very simply, is just an explicit statement of the desired outcome that is time-specific and measurable. They're important for a whole slew of reasons, a couple of which are on the screen here. First, it provides us with direction and a focus for our project. It helps you know where you're headed. It also establishes alignment, makes sure everyone on our team is on the same page and is working towards the same goal. I think this is especially important when we have team members from different areas of work, from different practices, from different organizations, and we meet virtually. Having that common statement to go back to really does help keep us aligned. And then it also acts as a really great communication tool. Once you develop your aim statement, it's going to be something that you can hand to someone outside of your team to help explain what it is you're working on and what you're trying to accomplish. So I really like this quote from Alice in Wonderland. It says, "Alice speaks to Cheshire Cat. Would you tell me, please, which way I ought to go from here? That depends a good deal on where you want to get to," said the cat. "I don't much care where," said Alice. "Then it doesn't much matter which way you go," said the cat. "So as long as I get somewhere," Alice added as an explanation. This quote really just reminds us that we need to be specific with what we hope to accomplish if we want to make purposeful changes. Without knowing where we hope to end up, we don't know which path to take. And I think this is especially important in this CoIIN because we're dealing with a population where there is so much room for improvement with the way we provide care. And we have to remember that we can't take on the entire world right now, and our aim statement is a great tool to help us narrow down exactly what we can do and what we hope to accomplish so we can make some purposeful, sustainable changes. And then this slide just reiterates again that we need to be specific about what we hope to achieve. We like to say some is not a number, soon is not a time, and hope is not a plan. We want to make sure we're being specific about how much we hope to achieve and by when we hope to achieve it by, so that again, our goals are meaningful. We aren't going to aim to increase our family engagement some by soon. We're going to set a numerical goal and set a deadline for ourselves to help hold us accountable. And then we're going to develop, record, and communicate our plan for achieving our goals by our deadlines. And we're probably going to have to refine that plan over and over again as well. And sort of in line with that, I do want to note that our goals, our deadlines, and our plans likely will have to change as we move forward. We are largely operating in uncharted territory here since we're trying innovative and new ideas. So the need to recalibrate is to be expected. And that's one of the things we want to be extra good about as a part of this CoIIN, is just being flexible to meet your guys' needs. All right. So any questions so far? We'll pause at the end as well. Okay, so I do see a good question here. What do we need ready prior to the April meeting? I do think if you could meet with your coach and sort of work on drafting that aim, which we're going to talk about here in a second, that would be really helpful. I also think if you could think about who you may want on your core team, as that will help influence who you bring with you to the in-person meeting, that would be really helpful as well. But don't feel like, you know, your aim statement or anything like that has to be in perfect condition. We are going to have time at the in-person meeting to continue tweaking that and to get some hands-on coaching and things like that. So great question. We're going to talk about that a little more as we move forward. And if we don't fully answer that question, please do bring it up again and we'll do our best to address it. So HRSA has provided some clear objectives for all our teams to focus on, and we've used these objectives to develop what we call a starter aim that your team can adapt. And this aim, again, is meant to provide direction for your team throughout the entire 3 or 4 year collaborative. So you can see it says the overall goal of our Children with Medical Complexity CoIIN team is to improve the quality of life for our state's children with medical complexity, the well-being of their families, and the cost-effectiveness of their care. We will do this by, and then there are a bunch of blanks, and those blanks are where you can insert the focus areas that you're thinking about working on. And then you can see some specific goals that we hope to accomplish by the end of the CoIIN, which are centered around increasing the number of children with medical complexities in the cohort, reporting a single point or locus of management in a patient or family-centered medical home, increasing the number of children with medical complexity in a cohort with a shared plan of care, decreasing the number of unscheduled hospitalizations, and then increasing the number of families who feel their needs are being met. And we are going to do a lot of work around measurement at the in-person meeting, and then moving forward as we get the KETA system set up as well. So as a part of your homework, we are going to ask you guys to think through how your team wants to adapt this starter aim, and your coach is going to be available to talk through that with you more on your first coaching call. Any questions about that? I know we're throwing a whole bunch of information at you guys. Okay. Well, if questions bubble up, feel free to interrupt me, please. And then in addition to creating an overarching aim for those, for the entire CoIIN project, we are going to encourage you to create a more specific aim for the first focus area that your team decides to tackle. I think we mentioned this a little earlier, but creating the smaller aim statement will help you think through how your first focus area will really link back to the collaborative level goals that we just took a look at. It's also going to help you scope your project, which is something that we'll be talking about a lot moving forward. So for example, you obviously aren't going to be able to tackle all of the issues with access to home care services. That would just be crazy. You're probably going to have to choose a subset of that focus area to work on with the hopes that you'll be able to spread later on. So I think one of our teams mentioned that they may look at the feeding tube transition from hospital to home. So this project, of course, would fit within that access to home care services focus area. And that topic is most certainly something that we could create an aim statement for that's specific to that smaller project within that focus area. And we do have a template to help guide you guys as you develop those focus area specific aims. You're going to get a copy of that template after this first webinar. It'll go out via email, and then you'll get to walk through it in more detail with your coach on your first coaching call. So I know this is a little confusing, but it will all start to come together, I promise. Just to recap, we're going to ask you guys to adapt that starter aim to reflect what your team hopes to accomplish over the entirety of the CoIIN. And then we're also going to ask you to consider creating an area-specific aim once you decide on your first project. And again, that's something we can talk about on those individual coaching calls as well. That template that you saw on the previous page simply helps you think through the key components of an aim statement, and we've listed those key components on the screen here. The first, of course, is what are we trying to accomplish? This is where we clarify the specific area of care that we're focusing on. It's the problem that we're trying to fix. It's the overall goal of our project within that focus area. So for example, like we just mentioned, improving feeding tube transition from hospital to home could be what are we trying to accomplish. And then there's the why is it important. This is where we cover who is it important to, who's it going to impact, what benefits are we going to get out of it. And I know that's something that's near and dear to everyone on this call. That's sort of the fun part, the why are we doing this in the first place. And then there's the who is the specific target population. We provided that baseline definition that you all are going to operationalize for your own project. So you'll get to use that to define your cohort of children. But when will this be completed by? That's the deadline we're setting for ourselves. And then the how will this be carried out? And the how will this be carried out isn't necessarily a list of specific to-dos. It's more about thinking about what resources and tools we're going to use to accomplish our goals. So the resources provided as a part of this CoIIN to be included in the how. So the collaborative partners that you have access to, the quality improvement methods and tools that you're going to use, those are all a part of the how. And then the what are our measurable goals? This sometimes is the hardest part. These are the measurable components of the overall objective. So for the feeding tube transition example that I've been referencing on this slide, a measurable goal may be the amount of training provided prior to discharge or the comfort level of the family member upon returning home. These are things you can measure to see if you're moving towards that overall goal. It's also really important at this stage to think through how these measurable goals connect to the CoIIN's overarching goals that we looked at a couple of slides back. And again, your coach is going to work with you to sort of dive into these components and make those connections on those first calls and then also at the in-person session. Any questions at this point in time? I'm not seeing anything in the chat box. So you do have a whole lot of information now. You've got the overarching CoIIN goals around increasing the number of shared plans of care and decreasing unscheduled hospitalizations and all of that good stuff. You also now have that baseline definition for children with medical complexity, which you're going to start operationalizing for your state team at the on-site. And then lastly, you've now got that list of focus areas, which you're going to discuss with your teams and decide which focus areas you want to tackle first. And then, like we mentioned, that next step really is going to be to develop your aim statements and help figure out where exactly you want your end goal to be. So this may all seem a little disjointed and a little overwhelming. That's okay. That's usually how it is in the beginning of the project. But we do want to promise that it's all going to start coming together as you're introduced to new tools, as you talk to your coach, and as you collaborate with others and learn from one another. And this is a very exciting time for our CoIIN because we are at a point where we're going to start to see all these things merge and to help us provide direction for our group as we do move forward. Let me see, it looks like we've got something in the chat box here. What measures, if any, are to be collected by the national group in this project, or are all the measures our own to do at the state level? So we are going to have, and Meg, I'll let you jump in here as well. We are going to have some common measures that we're going to ask you all to collect at the state level that will be the same for the rest of the, for all the teams. And we're going to aggregate those so we have some higher level data, aggregated data that we'll be able to share. And then your coaches will work with you to see if there are any additional individual measures that your state team wants to collect depending on what projects you choose. And then I'm sure at the project level, there's also some evaluation level data that we'll be collecting as well. And we're going to be talking about this a whole lot more as we move forward. So I'm not sure, Meg, if you've got anything to add to that as far as the data piece goes.
The only thing that I would add, Carrie, I think that was a great description, is if you're looking for sort of the neighborhood in which those national measures are going to be collected, then I'd refer you back to the objectives, the project objectives, which we went over in a previous slide.
Mm-hmm. Wonderful. So if you do have questions about your aims, your teams, again, reach out to your coaches. We will do everything we can to help make you successful. But one of the next big milestones that will help our CoIIN work move forward is, of course, that on-site session where we will get to see all of your smiling faces in person in Chicago. So like Meg mentioned at the beginning of the call, you all have received an email with a packet of information about that on-site. You'll see some of the highlights on the screen here. It is happening April 17th and 18th, coming up quick. We encourage you guys to arrive Monday evening or very early Tuesday. We do tentatively have an 8 a.m. start time. It will be happening at the AAP's shiny new headquarters in the Chicago area. You will see the address on the screen here. We do encourage you to bring up to 6 members, including a family and or youth representative. And then you'll see some information about how to book your travel here. So this is all included in that wonderful packet that Meg sent out. You'll see that registration link. It's a SurveyMonkey link on the screen. Once you register there, you will receive an approval email. Once you receive that approval email, you will be allowed to contact Short Travel to book your flight. You'll see the number and the corresponding code that you'll need to use on the screen. Again, also included in that packet that was sent out. Your hotel reservations will be made by Boston University. We'll be staying at the Westin Chicago Northwest. I've heard it's lovely. And you will indicate on that registration link which hotel nights you'll need your reservations made for. So if you have any questions about how to book your travel, contact Meg. She is the keeper of all the important information. We'll be able to help get that sorted out. We're looking forward to seeing you guys. We do encourage you to bring at least 1 laptop per team to these sessions. If you are able to, bring something to write with, and besides that, just bring your great ideas, your sense of fun, your excitement, and your readiness to learn. So I did see a question in the chat box here. When should we expect to receive the approval email for travel? And Meg let us know that those will be coming this week. They were started yesterday on a rolling basis, so be on the lookout for those. Any questions about the on-site? There is a draft agenda that was included in that packet if you need that for travel approval purposes. We do have a question about what time will the meeting be over on Wednesday. I don't have the agenda pulled up right now, and since I'm sharing my screen, but I want to say we ended around 2:45. Thank you, Allison.
That's correct, Carrie. 2:45. We want to try to get everybody out in enough time, get you back to the airport. So in a perfect world, you can get home on Wednesday evening and not have to stay an additional night.
There's another question about the earliest plane to take back. I'm not sure. I'm guessing it's going to depend on where you're traveling to, but I'm thinking, and Meg, correct me if I'm wrong, that's something Short Travel will be able to help figure that out with.
I think the question is more, when should I be thinking about booking a flight after a specific time? So we'll be about 10 miles away from O'Hare, but there's always, traffic considerations and security considerations and that sort of thing. I would, if I were the traveler, I leave this to your discretion, but if I were the traveler, I wouldn't book anything before 5 o'clock, and I'd probably look more like at 5:30, just to be on the safe side. O'Hare is a huge airport, and sometimes it can be a little time consuming just getting from the drop-off area to your terminal.
Wonderful. Other questions? I'm notoriously known for trying to cut it a little too close. So I should probably heed your advice as well, Meg.
And I'm notorious for being there really, really early. So there's probably a happy median there somewhere in the middle.
Those questions do come up, reach out to us. We will be refining the agenda a little more based on the feedback that we're getting from you all and our other collaborative partners, and we are looking forward to it. And then closing thoughts and next steps. Just a quick reminder that you are going to need to consider your institution's IRB process and be able to move forward with that. Boston University is working on getting their exemption available for you guys to submit along with yours, if that would be helpful, and we'll be in touch as that moves forward. As far as upcoming milestones, you all should have gotten an email from your coach. If I am your coach and you responded to me last week, I have been doing my best to get back to you all I was out, and if I have not responded, I will get back to you either today or tomorrow, I promise, and we'll get that first call scheduled. So I appreciate you guys filling out that survey with your date and time preferences. Also, we encourage you guys to continue meeting as a team to help move some of this work forward. And then, of course, make sure you're planning for travel for that upcoming on-site. We will also be sending out the schedule with the upcoming webinar dates here shortly. And then you will see the evaluation for today's webinar on the bottom of the screen here. Please do take a second. It'll only take a minute, and it's very valuable feedback for us as we continue to tweak the sessions for the on-site and those future webinars as well.
Carrie, if I could just jump in and go back to IRB for just 1 second.
Yes.
So it's my feeling that there's a strong possibility that we will be granted a QI exemption by Boston University's IRB, but an IRB decision is never a done deal until you have the letter in your hot hand. So I just wanted to put that caveat out there. We are applying for an exemption as a QI project, and I have a strong feeling that that's the way it will go, but it's not for sure until we have that. So I just wanted to make sure that folks were aware of that.
Yes.
Carrie,
we have a question.
Yeah, a question in the chat box. Is it possible to receive a roster of all the family representatives from the states involved? I think that's a great idea. I'd be happy to do that.
Any other parting questions or thoughts? Okay. I know we're finishing about 10 minutes early here.
Just going back to 1 second. Oh, I'm sorry, was there another question?
No, I was just seeing in the chat box that there was a question about how would a QI exemption at BU affect other sites.
So you still have to go through your own IRB process, but sometimes, different IRBs have different criteria for how they determine exemptions versus different kinds of IRB protocols and approvals. So sometimes it can be helpful when the funding institution's information goes to an individual institution's IRB, just to give them some additional background information. So because Boston University, if we have a QI exemption, it doesn't necessarily mean that you will for your institution. It will, however, potentially provide additional background information that could be helpful to your IRB in making a determination. I hope that makes sense. And I just want to add, I'm sorry, Carrie.
Sorry,
One last thing, two last things. So one, as Carrie said about the evaluation, it's really, really, really helpful to us in improving our processes QI project, and so we want to walk the walk as well as talk the talk. So please take that 1-minute survey and help us out, especially where we got off to a little bit of a rocky start with our web-based meetings. I'm really, really interested in making sure that we continue to meet your needs, and that these are not training or technical assistance opportunities that you dread, that they're actually good for you. The second thing that I just want to mention is when you reference back to that value-driven decision-making, that's one of our, here at Boston University, one of our values. We end meetings on time, if not early. So that's just one example of how you might think about value-driven decision-making. It's what are your core principles? What are the things that you're really committed to? What are the things that philosophically you feel really strongly about? Not just about process, not just about policy. I think that for us, that's been really helpful having those values sort of laid out, shared amongst our team. We have a shared understanding of them, and it just helps facilitate how we make decisions moving forward when we have those sort of culturally in the back of our minds. I just wanted to make that point. If anybody has any questions about that, it might be a little different from how you're used to thinking about project design, please don't hesitate to reach out. Okay, that's it for real this time. I won't interrupt again.
I was just going to say thank you guys so much for joining us. As always, we appreciate you giving us the time, and we look forward to talking again soon.
Yes, thank you very much, everybody.
Thank you all. Have a great day.
Thank you.